Hey Gally, Annelise here, a certified financial planner professional and a Crohn's disease patient myself. And today we are here to talk about how much money should we save and how do we even start? This is a question that I get all the time as a financial planner. And I want to say that financial planning and budgeting is personal. Personal finance is personal. So please take whatever we talk about here today and apply it to your specific situation. But with that said, there's a general rule that I think is a really good starting place, and that is the 50-30-20 rule. Meaning 50% of your take-home pay, so whatever goes into your checking account each month, would go to needs. And that is things like housing, transportation, utilities, groceries. All of your needs lives in that 50%. 30% of your take-home pay goes to wants. So this is things like entertainment, dining out, getting your favorite coffee at the local coffee shop, travel, back when we could do that. All of those things live in that 30% allocated to wants. And then 20%, which in my opinion is the most important percentage of all of them, goes towards increasing your net worth. Some people call this paying yourself first. But what it really means is going towards things like paying down debt, saving towards retirement, increasing your emergency fund. Anything that's going to increase your net worth lives in that 20%. So 50, 30, 20. 50% needs, 30% wants, 20% increasing your net worth or paying yourself first. One place that I see people going awry with their budgets is using something like Affirm. You've probably noticed this when you go to buy something online. It says, do you want to pay in full now or do you want to pay in 4 payments of X dollars? So let's say you bought something for $100. It would say, do you want to pay $100 now or do you want to pay $20 for 5 months? This is something that I really, really don't like to see because it allows you to purchase more than you could probably afford right now. So it's a really good rule of thumb. If you can't pay for it in full right now, you need to keep saving before you could purchase it. Of course, this doesn't apply when you're talking about medical needs. You know, if it's your health, you need to purchase whatever you need to purchase and work on a payment plan to get it paid off. But when it comes to things that are wants, really, really important, only buy what you can pay in full. So let's talk about how you can actually start doing this. How can you set up a banking system that allows you to do this really easily? My favorite is to set up one checking account for your needs, one checking account for your wants, and another savings account for paying yourself first. So this is 3 total accounts. 2 checking accounts, 1 savings account. And you can even use debit cards for each of the savings accounts for needs versus wants. So if you've allocated 50% of your take-home pay into your needs account, you can use your debit card for that account every time you're purchasing a need. On the other hand, if you're wanting to buy a want, let's say you're going and picking up takeout at your favorite restaurant, you can use your debit card for wants for that. This is great because you're making the bank remember how much you've spent, and you don't have to do any of that yourself. So as you get comfortable with this system, you can increase the number of savings accounts for specific goals. So let's say you want to save for a down payment on a house. You can make a specific savings account and make a specific allocation for that goes into that account each month for that. You can have as many accounts as you want. But just remember the basics are 1 checking for wants, 1 checking account for needs, 1 savings account for paying yourself first, or that money would go towards paying down debt. So if you aren't in a place where you can save 20% of your income right now, that is okay. This is just where we want to get to. So if you're living month by month, start by saving $10. Then increase it to $20, then increase it to $50. And when you start automating that savings, having automatic transfers go from the checking account your pay goes into to the savings account that you just set up, you will start to not miss that money. you won't miss it. It won't be there. And that can really help expedite the savings process. So just remember 50, 30, 20. 50% needs, 30% wants, 20% paying yourself first.